Welkom in Leiden, welkom in Museum Boerhaave, welkom iedereen hier in de zaal en welkom iedereen die online meekijkt. Sorry dat we iets later waren. We hadden wat technische problemen van allerlei soort, maar die zijn nu allemaal opgelost. Welcome to this lecture of Manon Parry. This lecture will be in English. We really invite you to join the discussion. If you have a question, use the chat function. Keep it short and bright. The same for the people here in the audience. Make a question, even if you know everything about the theory. And I'd like to introduce Manon Parry. I think she's a real cosmopolitan citizen. Her research and her work extends to all corners of the world. And she is connected to the two universities of Amsterdam. She's a professor at the VU University. And she is also a senior lecturer in American Studies and Public History at the University of Amsterdam. And she is also a great curator of all kinds of exhibitions on medical history. And she also has a Veni grant.
Veni.
And I think it's nearly finished for the last 4 years. You worked on it. Maybe you will tell something about it. Because Manon Parry really reflects on the meaning of making an exhibition, what we can learn from that. And she made a research also on other pandemics. We live in it now. We're hoping to overcome it. But what do we learn, for example, or what do we not learn from it, for example, from times that AIDS came into our lives? And this afternoon will be very vivid, because Manon Parry will speak, will talk, show slides, but we will also see the first minutes of a beautiful, very moving film she made with interviews, people who were the first to get bothered by HIV and AIDS. I won't talk too long. Manon Parry, thank you for being here, and the floor is yours.
Thank you very much. This year marks 40 years since the beginning of the AIDS pandemic. Since then, more than 34 million people have died of AIDS-related illness, and more than 37 million people are living with HIV across the globe today. Yet since the emergence of COVID-19, government leaders and media commentators have frequently stated that this pandemic is an unprecedented event in modern history, and that we've not lived through anything like this in our lifetimes so far. The students I teach, including medical students in health humanities courses at the Vrije Universiteit, tell me they know very little about the history of AIDS. And in the classes where I make connections between this past and the present pandemic, they're surprised to learn that our current situation has much in common with responses to HIV and AIDS. Instead, the most common comparison made is to the influenza pandemic of 1918, which can be easily linked through the nature of the spread of influenza, like COVID-19, and the imagery of masks. The 1918 pandemic was also at the forefront of some of our minds due to the 100-year anniversary in 2018, when numerous projects were launched to mark this moment in history and to warn of the threat of a potential new disease. Labeled Disease X by the World Health Organization, this imagined threat was intended to galvanize efforts to prepare for and prevent the emergence of a new infectious disease pandemic. Across many history projects focusing on the 1918 influenza pandemic and the threat of a possible disease X, the tone was urgent, the imagery dramatic, and the message a stark and foreboding warning. These stylistic choices suggested the need to wake people up from complacency, as if the triumphs of modern medicine and public health had alleviated the risk and the fear of infectious disease. But the AIDS pandemic has not been solved. After 40 years, there's still no effective AIDS vaccine. 1.5 million people become infected every year, And while people can now live for years with HIV if they have access to the necessary medications, aging with HIV and long-term AIDS medication use bring new health challenges, which can still shorten lifespan. Even so, this ongoing pandemic is so under-acknowledged in rich Western countries in particular, that a common slogan in AIDS activism has become the reminder that AIDS is not over. Now, there are various reasons for the forgetting of AIDS, including the shift from HIV infection as a death sentence to a manageable chronic condition, the lower rates of HIV achievable in countries with wide access to the resources that support health and well-being, and the still marginalized groups that remain most affected. But today, I want to focus on another major factor, and that's the way that the story of AIDS has been told, and how the collection and interpretation of this history has left us with a very narrow view of this past. As the COVID pandemic unfolds and we document this major event so we can learn from it in the future, there are clear parallels between the two. Now, curators and theorists have described AIDS as one of the most culturally productive phenomena of modern times. The creative arts played a crucial role in defining and redefining the pandemic since the first cases were identified in the early 1980s, with art used for activism, expressing grief, memorializing the dead, and in public health education. Responses to AIDS include a rich array of film, literature, visual and performance art, public health campaigns, and protest material. And from the very beginning of that pandemic, museums and archives were collecting, as staff recognized they were living through a moment of enormous historical significance. But despite the breadth of the material traces of AIDS, just a few types of objects are most often displayed in museums and art galleries, shaping the narratives of this history in significant ways. Oops. Now, perhaps the most commonly found things generated by the pandemic and collected in archives and museums are the materials associated with HIV education. Although designed only for short-term use, posters, leaflets, and postcards are the predominant cultural traces of AIDS that have been professionally preserved. Multiple copies of mass-produced campaign posters and flyers were created, and therefore many examples have survived, proving especially resilient in comparison to more personal items, which are sometimes destroyed in grief or kept privately as a link to someone lost to AIDS, rather than donated to a museum or archive. Collections include a wide variety of types of campaign materials, from the glossy mass-produced media of national government-led campaigns to the smaller scale output of artists and community groups working with more limited resources. Another influential factor in their survival is the ease with which two-dimensional paper and card can be stored, especially compared to the challenges of caring for some of the other material traces of HIV and AIDS. The Names Quilt, for example, the world's largest folk art project, is made up of thousands of textile panels created to commemorate individuals who've died. Preservation is costly because of its size, as well as the complexities of preserving and restoring so many different kinds of handcrafted objects made up of such a variety of elements. Such factors also shape the reuse of material culture in the history of HIV and AIDS. Posters are easier to exhibit than three-dimensional objects, and copies and originals with many duplicates can be shown in a range of settings without the need for temperature-controlled exhibition cases, expensive insurance, or specialized transportation. Temporary exhibitions, such as those marking World AIDS Day on the 1st of December, often draw on such materials precisely because they can be so quickly used, the real artifacts or reproductions of them displayed. It's also common to see copies in public spaces, on the streets, public transport, and city government buildings, with an educational message about HIV awareness. And due to the ease with which they can be digitized, plenty of examples are available for use online or to download. The sheer variety available makes it possible to exhibit the broad reach of the global pandemic, representing a range of countries around the world. However, these materials give only a shallow sense of the place of a specific campaign within a wider range of activities, not to mention the gap between the expected and actual impact, or how audiences reacted. Generally, these exhibitions don't provide information about the production of the campaigns, and there's even less attention to the reception of these materials in the various settings where they were used, from city centres to schools. Without much information or explanation, then, public health promotion is instead often presented as visual art. The recent exhibition, AIDS Based on a True Story, drew on a collection of 10,000 AIDS posters from 147 countries housed at the German Museum of Hygiene in Dresden, intermingled with art and activist material reflecting the visual culture of HIV and AIDS. The exhibition highlights some of the key challenges of relying on these compelling visuals to convey the complex history of AIDS across its social, cultural, and political dimensions. The exhibition consisted of 6 rooms, with each organized by a theme, such as the virus or living together. The rooms moved forward in time in a loose chronology tied to phases of scientific discovery, including the identification of the HIV virus, through to the development of effective medical treatments, and the posters shift in emphasis from warning of a deadly disease to depicting people living with HIV. The exhibition also included a timeline, reinforcing this narrative of increasing knowledge and better management of the threat. Such progress narratives are common to AIDS exhibitions, especially those on specific anniversaries or World AIDS Day, because they're stimulated by the passage of time since the first cases of the new disease were noted. Even without explicit reference to a timeline, by contrasting the death toll of the early years and varying rates of infection in different regions or moments, such projects commonly suggest a beginning and anticipate an end for the global pandemic. And yet, AIDS is not over. In 2017, the Wellcome Collection in London displayed a temporary exhibition curated by designer Lucian Roberts and design educator Rebecca Wright, titled "Can Graphic Design Save Your Life?" The exhibition storyline was enthusiastic and implied that it could. Although the curators addressed some unhealthy uses of design, such as tobacco advertising to promote smoking, the exhibition highlighted the beneficial power of persuasive media to convince people to act in ways that improved their own well-being and public health more widely. The exhibition also featured the UK health education campaign, informally known as the Don't Die of Ignorance Project, after the main tagline of the television adverts and print materials. A short label noted that the campaign was controversial, but also very memorable. A newspaper article promoting the exhibition included interviews with the government minister for health at the time and one of the designers, both reflecting on its history. They commented on the difficulty of the project due to policymakers' disagreements and argued that their menacing tone was necessary and successful. Yet ever since this campaign, historians, public health practitioners, and policymakers still disagree on its effects and on the use of fear to promote behavior change. The adverts have been blamed for frightening audiences and potentially increasing prejudice against high-risk groups. By isolating this effort from the wider variety of activities underway at the time, the history also suppresses the role of other campaigns and services and ignores the influence of amplifying or competing representations of AIDS in the media and wider culture. Critics argue that rather than serving as a serious public health effort to save lives, this campaign was primarily a public relations exercise for the government. And it may actually have proven more long-lasting in terms of fear and stigma than generating any real health benefit. Yet the politicians and designers involved now claim it as an unqualified success. And despite numerous scientific studies questioning the impact of fear-based health communication, the strategy is making a comeback. This revival is particularly worrying in the current climate of distrust of expertise and the spread of fake health news, as it seems dangerously counterproductive, potentially eroding the already fragile credibility of public health advice. This is one of several forgotten lessons of the AIDS pandemic, which are especially relevant for responding to COVID-19. Another relates to the process of forming knowledge in a rapidly developing situation. In the fast-moving emergence of a new pandemic, amidst uncertainty about who is affected, how far and fast the disease will spread, and how to treat it, assumptions made in the earliest stages can prove hard to shift even as evidence against them mounts up. For AIDS, this included the early misidentification of AIDS as limited to 4 groups, which underestimated risks to others. In the United States, Black men with symptoms in the early years of the epidemic were left out of the first reports on the new disease, as the epidemiologists tracking cases thought they were outliers rather than part of the core data. The focus on gay men also led the Centers for Disease Control to under-research the symptoms experienced by women, making it difficult for them to get diagnosis as well as appropriate treatment. For COVID-19, the focus on elderly men as the highest risk category made it harder to recognize the signs of long COVID, which seems more likely to be experienced by women. Another lesson is the role of blame and stigma in undermining public health. This was the crucial point emphasized by Jonathan Mann, who headed the World Health Organization's response to the AIDS pandemic in the early years. He argued that stigmatizing people with HIV would drive them to hide their status or avoid being tested, making it harder to control the spread of the virus. And his approach helped to transform policies around the world. For COVID-19, governments, law enforcement, and the general public have participated in activities intended to shame people into compliance with corona measures. With the rise of the hashtag COVIDiots, people use Twitter to call out the behavior of others as irresponsible or called the police on their neighbors. Such moralizing behavior, directs attention away from the inconsistencies in the restrictions which may have undermined people's enthusiasm for them, and ignores circumstances that might make it harder for individuals to comply, from the shock of coping with a rapid change of events to previous negative experiences with government or healthcare services, or the challenges of staying home without the support needed to do so. A final lesson I want to share here is that pandemics are not just biomedical phenomena. An important lesson from the history of AIDS is the role of social factors in determining who is most at risk, how ill they will become, and whether they can access the health care they need. Knowing how to protect oneself from infection is not enough, as risk factors for contracting HIV include inequality in sexual relationships, social and economic marginalization, mental health and addiction issues, low levels of education, and a lack of access to services or a safe place to live. So while we know how the virus spreads, people will still become infected because they're not able to protect themselves. Whether that's because they rely on sex work for an income, drug use to alleviate hardship or trauma, or because they don't have the power to insist on safe sex in their relationships. All of these issues are relevant for the response to COVID-19. While we know how that virus spreads, people will still become infected if they work in a job without adequate protection, or if they live in crowded conditions, for example. And while we consider some groups especially at risk or vulnerable to severe disease, underlying inequalities are as likely a factor as any underlying health conditions. And yet, the most attention and most resources are directed at only a very small piece of this puzzle, focusing on vaccine development. But the pandemic will not be solved by a technological medical breakthrough on its own. We're already discovering that effective treatments and vaccines may not be enough to cope with the emergence of new variants, problems with long-term efficacy, and concerns about side effects. Ensuring access to vaccines, tests, basic health services, and supporting everyone's ability to protect their own health remains a challenge around the world. And as long as the virus circulates elsewhere, it will be reintroduced to other regions. So how can we do a better job in collecting and interpreting the past and applying its lessons to the challenges of the future? I argue here that the process begins with a wider effort to gather evidence of the impact of pandemics across all of the communities affected and all of the different groups involved in the response. Voices of the Epidemic is one attempt to supplement existing histories of AIDS in the Netherlands with a broader range of perspectives. The project was developed with a team of collaborators and funded by the Public Health Service of Amsterdam as part of the activities accompanying the 2018 meeting of the International AIDS Society in the city. The full film's online on YouTube, and we're just going to show 10 minutes here, which focuses on the early years of AIDS in the Netherlands. Cross your fingers and toes that this works.
Nou, de eerste keer dat ik over AIDS las, was in de zomer van 1982. Ik studeerde toen en woonde op Uidenstede, dus ik zat op mijn studentenkamertje de Volkskrant te lezen. En daar stond een verhaal in van Jan van Wieringen, die de toenmalige Amerika-correspondent van de Volkskrant was. En hij schreef over een nieuwe ziekte die zich in Amerika had voorgedaan. En in een bijzin stond nog even dat ook mensen met hemofilie, dus een afwijking in de bloedstolling, dat ook die kans liepen om die onbekende ziekte te krijgen. En dat was in juli 2082.
Ik kan me herinneren dat op een gegeven moment was er iets op het journaal. En ik was op dat moment eventjes bij mijn ouders op bezoek en dat mijn moeder zei van, je past toch wel op, hè? Je kijkt toch wel uit, hè? Ik zeg, ja, maar dat is in Amerika. Daar hoef je niet druk over te maken. En toen ik weet niet meer wanneer, maar ik kan me herinneren dat we aan de Amstel bij een kroeg, stonden we altijd op zaterdag of zondag, in de zomer met een pils en gezellig. En dat 2 vrienden van me, die hadden een artikeltje uit de krant over deze Amerikaanse homoziekte. En dat waren de eerste. En daar deden we allemaal heel erg lacherig over. Van ach, wat een onzin. Maar die 2 jongens die dat lieten zien, zijn allebei overleden aan AIDS. En we deden er allemaal echt, we bagatelliseerden het volledig.
Ik kwam 26 jaar geleden, heb ik HIV gekregen van mijn man, die overleden is aan AIDS inmiddels. Dat is een half jaar na de geboorte van mijn dochter. Daarvoor was ik al bekend met HIV en AIDS door wat er in de kranten stond, wat op tv kwam. En Freddie Mercury was net overleden. En vanuit die link had ik begrepen dat er mensen met AIDS in het AMC lagen. En ik dacht, ik ga daar naartoe om de mensen een anje te geven. Niet wetende dat ik zelf op Hemelvaartsdag 1992 geïnfecteerd werd met het HIV-virus.
Het moment dat ik hoorde dat ik HIV had was in 2000. Mijn partner, de vader van mijn oudste dochter, die kwam in het ziekenhuis terecht. En toen werd er gezegd dat hij seropositief was. Dus ik dacht, wow, seropositief. En ik dacht, ja, alleen homo's hebben dat. Ik wist helemaal niks erover. En op een gegeven moment zeiden ze van AIDS. Toen dacht ik, AIDS, daar weet ik wel iets over, want het is dodelijk. En toen zei ik gelijk van, hoe zit het met mij? En toen zei ze van, ja, je kan je wel testen, maar sommigen willen zich niet testen. Ik zeg, ik wil gelijk, ik wil meteen. En een week later kreeg ik de uitslag en mijne was ook positief. Ja.
In het begin ook denk je van, ach, het zal wel loslopen. Er is maar een heel klein percentage van de besmette mensen die ziek zullen worden. En een klein percentage wat dan dood zal gaan. Dat was de filosofie in die tijd. Totdat het zich omdraaide en dat werd gezegd, iedereen wordt ziek en iedereen gaat dood.
Ik kan me heel goed herinneren dat deze vriend, die had in principe een keurig leven. Geen losbandig leven. En hij had op een bepaald moment, dat vertelde hij me, hij had op een bepaald moment een Duitse vriend. En een paar weken later kreeg hij last van, ik kan me niet goed herinneren wat voor verschijnselen, maar verschijnselen die toch al meteen verdacht waren. En toen is hij naar de dokter geweest en toen was de uitslag en ik was op mijn werk en hij belde me en in tranen dat de besmetting was geconstateerd. En ik geloof dat ik toen meteen naar huis ben gegaan of naar hem toe ben gegaan om hem, laten we zeggen, op te vangen. Maar het was in feite een doodsbericht, hè, voor hem ook. Hè. Dus de paniek was meteen enorm. En ook niet alleen omdat je wist dat het einde dan nabij was, maar vooral ook omdat men niet wist wat er dan nog verder zou gaan gebeuren.
De andere kant was dat het toch een groep mensen was die een beetje in de periferie van de samenleving leeft. Dus die kom je ook niet elke dag tegen. Het was een bijzondere patiëntengroep. Daarnaast had het iets met seks te maken. Het was ook overdraagbaar. Dus ja, als je niet uitkeek, dan kon jij het ook nog oplopen. Of een andere ziekte kon je oplopen. Dus ja, dat was wel gek. Het was bijzonder. En iedereen wist dat. En tegelijkertijd werd het ook ontkend. Vooral door de buitenwereld werd daar toch wat vreemd tegen aangekeken.
Wij hadden heel veel seropositieve vrouwen in huis, waarvan we niet wisten dat ze het hadden. Dus op een gegeven moment gonsde dat wat. Babytjes werden geboren, ze kwamen ook zwanger bij ons. Babytjes werden in het AMC geboren. Het AMC was het enige ziekenhuis in Amsterdam die dat begeleidde. Wij wisten niet dat ze seropositief waren, dat hoorden we dus later. En toen raakten we wel in paniek. Het is niet helemaal het antwoord op je vraag, maar wij raakten heel erg in paniek van het feit dat de babytjes ook seropositief waren. En wij waren er al maanden mee bezig, want het is natuurlijk een enorme zorg. En ook met die ouders erbij, om dat een beetje in goede banen te leiden. Dus je raakt de kinderen voortdurend aan. Toen ik woonde in Almere en ik reed motor, ik denk dat ik ben heel snel naar huis gereden. Ik heb uren onder de douche gestaan, terwijl het natuurlijk belachelijk was, omdat ik al zes maanden met die kinderen werkte. Ik had wel 2 kindjes thuis ook, dus ik ben me helemaal kapot geschrokken. Echt heel erg. Uiteindelijk kregen we wel een voorlichting, wat ik net al zei. Die heeft ons wat gerustgesteld. En we hebben toen pas voorzorgsmaatregelen genomen. Die moesten we dan wel doen. Daarvoor hadden we dat ook niet. Handschoenen en een schort. Dat is wat we kregen.
Dat was dus in zekere zin voor iedereen een hele angstige periode. Omdat er was dus sprake van een mogelijk gevaar zonder dat je precies kon aangeven hoe groot dat gevaar was. En als patiënt, maar ook als ouder van jonge kinderen met hemofilie, was het dus zo dat je eigenlijk, ja, zowel de artsen als die ouders als die patiënten zelf, die spoten dus 2 tot 3 keer per week die medicijnen in. Dus een van de eerste dingen waar we ook aan dachten was van ja, misschien moeten we stoppen met het gebruik van die medicijnen. Dat is een besluit wat sommige mensen genomen hebben en het is een besluit wat sommige mensen niet genomen hebben, omdat ze dachten van ja, de gevaren van het niet nemen van die medicijnen zijn waarschijnlijk groter dan het oplopen van dat virus. Dus dat was een soort afweging die je moest maken. Maar we hebben dus in totaal ja, toch 3 jaar moeten leven met de onzekerheid dat we medicijnen toedienden waar mogelijk dat virus in zat.
Dat je heel langzaam gaat realiseren wat er nou werkelijk aan de hand is. Maar je weet nog helemaal niet wat het verloop zal zijn. Dus de ene keer denk je van, ach, het zal wel loslopen. Andere keer, dan zie je jezelf over een half jaar al in een kist liggen. Totdat het nog dichterbij kwam dat mijn eigen vriend ziek werd in 1989. En ja, dan wordt het heel erg, komt het heel erg dichtbij. En toen had ik helemaal van, hij is in 1991 overleden. En ja, toen dacht ik ben de volgende die in die kist ligt.
Als je zeg maar in die tijd die diagnose kreeg en de straat op werd gestuurd van nou ja, dat is het. Dan kon je verschieten in ontzettend depressief en helemaal niks meer willen. Of in heel veel activisme en heel veel doen. En ik zat in dat laatste schuitje. Ik had heel veel vrienden om me heen in New York die echt dachten van we moeten die hele fucking wereld veranderen. Want het gaat gewoon echt helemaal nergens over. Ik kwam bij ACT UP in New York en dat was echt een organisatie waar we gewoon echt, ja, we hebben gewoon hele gekke dingen gedaan. Echt de stad geblokkeerd, met as over de hekken bij de White House, met mensen in open kisten door de straat, kerken geblokkeerd. Het was gewoon echt de stad New York lam leggen. En actie vragen vanwege het feit dat je niet gehoord werd als groep, weggezet werd als eng en besmettelijk. En eigenlijk werd gedecriminaliseerd en ook werd bestempeld als je bent geen mens meer.
The rest of the film goes on to explore aspects of care from hospitals to home settings, living with HIV, and stigma in the past, but also today. It's a starting point for expanding the history of AIDS and including the perspectives of a broad range of people affected. And I know there are other plans to mark the 40th anniversary this year by capturing other missing histories. We can recoup some of this past through interviews, alongside surviving artifacts, such as panels from the Dutch AIDS memorial quilt, some of which were displayed as part of this exhibition, AIDS in Amsterdam, shown at the City Archives in 2018. The Boerhaave has also recently added a portion of the quilt as its first AIDS object to be included in the museum's collection. But other historically significant artifacts seem to have been lost, including a scrapbook of photographs and postcards from one of the country's first hospital wards for AIDS patients, as well as the first handwritten version of a guide to caring for someone dying of AIDS, which was used to train carers in the Dutch buddy system. For those of us who lived through the intense early years of the AIDS pandemic, it's difficult to believe that so much of this history has disappeared. It's hard to imagine undercollecting or forgetting COVID-19, but the experience with AIDS shows that this is entirely possible. And in fact, before the recent anniversary of the 1918 influenza pandemic, there appears to have been very little public memorializing or reflecting on that event and its lessons over the course of the 20th century. A large number of online platforms have been launched to capture the impact of COVID-19 across different groups. The surge in digital communication fueled by bans on travel, the closure of workplaces and educational institutions, and the call for people to stay home has made digital collecting a priority now that so much of life is lived online, as well as a necessity given the restrictions on movement and meeting up. And the scale of stories that can be captured in this way is impressive. There's an array of projects targeting specific communities, such as students, healthcare workers, and people with disabilities. But unless this approach is supplemented by additional art activities to collect objects, silences in the history will persist as they have for AIDS, especially for groups without easy access to digital tools, including the elderly, as well as poorer people and those living in institutional settings, such as care homes, prisons, and mental health facilities. And this is an especially important issue, given that all of these groups face particular risks in this most recent pandemic. While we could mine digital collections for ideas for objects to be collected by museums in the future, some may well disappear before curators can reach them. These collections will form the basis of the histories we construct in the coming decades. AIDS powerfully demonstrated the interlocking social, economic, political, and cultural factors that shape risk and response. And COVID-19 requires a similarly complex view. A focus only on the medical issues, highlighting the structure of the virus, the ways infection spreads, and the timeline of discoveries made, would obscure other important dimensions, such as why some communities were harder hit, how contradictory information muddied health advice and fueled non-compliance, and how scientific conflict, as well as cooperation, have played out across countries. A social history emphasizing the range of community responses, such as banners supporting essential workers and pictures hung in windows to encourage positivity, might capture the most well-publicized activities, but misses less media-friendly efforts, those on a smaller scale, and more distressing experiences of isolation and loss, as well as the activities of groups protesting corona policy, who may be left out of collecting efforts entirely. If we assume that the scale of this crisis is large enough to ensure its preservation in the historical record, and neglect the need to gather a broad range of materials to reflect the diversity of its impact, the end result may be a narrow picture of the past with limited relevance for preparing for the future. And I'll end there and look forward to our discussion. But if you're interested in reading more about my work on public memory of medicine and disease, you can follow me on Twitter or look me up online at www.pulsenetwork.nl. Thank you.
Thank you, Manon, for this really nice lecture. I don't know, Gerlo, are there any... Gerlo, not yet. If you have any questions, please put them in the chat and then they will come to me. If you have any questions, ask them and I will repeat your question.
I was wondering, you showed that, for instance, the public health campaign of the, I think the UK government maybe inadvertently helped stigmatize AIDS patients. And I was wondering, and you said that modern posters maybe didn't have the lessons learned from the past. How could this public health campaign with COVID have learned better from the past? For instance,
I will repeat your question and will shorten it a bit. But, well, the main question is, what can we learn from history? For example, what you showed in British collections of modern posters about AIDS. What can we learn also from longer ago, from public campaigns? What should be used now? My own question was, have you ever been consulted by the Dutch government with all your knowledge on campaigns and on healthcare?
Well, I think there's been a very heated debate amongst historians, even within the community of historians of medicine, about how relevant lessons of the past are, particularly how do you take something from a completely different disease and a different moment in time and apply it in this moment. But it's clear, in my view, that everything we do today is a product of the past anyway. And so for your example of poster campaigns, we've very quickly reverted back to shame and fear as a strategy to shock people into complying. And the slide I showed about Disease X and all of those exhibitions from 2018 were very much doing the same thing. You know, there's this idea that if we frightened people enough, we would get more resources to invest in pandemic prevention, and we would be better able to respond to the threat. And I think as we looked at the impact of those strategies in the past, of fear for other health issues too, it's actually not very effective, and people can't always comply anyway. So you increase stigma, you raise fear, and also sometimes a kind of nihilistic sense that I can't do anything to protect myself. So it can be really counterproductive. But in terms of whether the Dutch government has asked for my opinion, no, they haven't. And that has been another issue. Historians here have been arguing, right, that they should be on the outbreak management team. And in Germany, historians are included. In the UK, there's a very active group of historians working on history for public health, who look at how reactions to previous pandemics have played into policy decisions being made now. So there's a real variety of opinion across different countries at this moment about how useful a historian's perspective is.
But can you see anything, what happened in Germany, for example, had the historians any influence on how the story has been told?
Well, I haven't looked closely into what's happening with the influence on COVID at the moment, but I tell you that now the World Health Organization is interested in learning from historians and thinking about cultural contexts of health and well-being. And so I'm part of a project there investigating the history of previous pandemics and what we might learn from them. And I think one of the conclusions that we're already thinking about, which seem to be coming up at the World Health Organization too, is the idea that we have underestimated our audiences for messages. So we focused on making simple messages and not worried about who is saying them as long as those simple messages are getting out there. And what we're realizing now is that the credibility of people delivering those messages is important. Yeah. And simplicity can be more confusing because as advice changes, some of those messages start to look hypocritical or inconsistent, and they don't help people learn for themselves how to evaluate risk and make decisions in that changing environment.
Yeah. Other questions? Go ahead.
Can you name an example of three-dimensional objects which could be placed in a museum considering the AIDS pandemic?
To make people aware?
You mentioned that there were not a lot of three-dimensional objects, but of course I'm just 21, so I don't have any idea of how life was then. What are examples of three-dimensional objects which could be put in a museum?
I'll translate because people who are looking at it online cannot hear your question. Can you give examples of three-dimensional objects that could be placed in an exhibition that people could learn from? Because it's hard to imagine.
It is hard to imagine, and I think part of the the argument that I'm making is that we need to talk to a wider range of people, right? So we learn their personal stories, and it may not be an object that is necessarily iconic, but it might be very personal to them, but still tells a valuable story. But one thing I can think of when I was previously curating an exhibition on global health, and I wanted to find examples of fake AIDS cures. So the kinds of things that were sold on television adverts and things. There was a foam that you could supposedly spread on your skin that was supposed to protect you. These kinds of things that take off in a crisis situation, right? And I spoke to an archivist at the Food and Drug Administration in the US who you would think would collect those kinds of fake materials, and he didn't have any of them. And he said he was unsure about if he had collected them, whether he would let me show them, because they might confuse people. And when I think about the moment we're in now, wondering about how to deal with fake health news and fake cures, if we had done a better job of preserving even the wrong things in the past, we might have been able to show people and teach people over a longer term to bring some skepticism, you know, or to see those patterns.
Yeah, also what you called the non-media friendly content needs to be collected.
Yeah.
Yeah. Other questions? Or
Yeah. My opinion, I need to ask people, people who talked in the documentary, or people or patients with HIV, to ask what object defines that time period for you? Maybe that's a good idea for.
yeah, if you were about to make an exhibition on AIDS, what objects would you choose? What marks this period for you?
Well, I think the question, you know, by emphasizing what would people choose if you asked them today, is precisely part of the problem. Some of those things that might have been important may already have been lost. So we need to be asking people about COVID now, what are those objects that have such meaning for you that we could collect? But I recognize too that it's very difficult to imagine what to select. You know, when I've asked people for other projects to choose an object to donate to an exhibition, it puts a lot of pressure on people because they think, oh, I don't have anything special or so valuable that it belongs in a museum. So we have to think a little bit differently about what museums collect. And another big problem is that if we recognize the social determinants of health, you know, that slide I showed that thought about all of the different aspects that go into making somebody at risk or increasing or decreasing their ability to cope with an illness or a risk, that is way beyond a simple medical invention or a vaccine vial. You know, that means collecting across all sorts of different aspects of society, so cultural, social, and no one museum has the space or the mandate to do that. So there's a real practical reason as well why museums have limited material.
It might be helpful for all of us as an exercise to imagine what kind of object would you collect now
for COVID.
For COVID. What would we give to, for example, here the Boerhaave Museum to collect that in 10, 15, 50 years we would remember or represent well the time we are living in and what we lived.
Yeah. Is anyone brave enough to name
Who
one?
has an example? Yeah.
The ventilator.
Yeah, the masks and breath appliance. Yeah.
Pictures taken regarding COVID, the signs to follow or what you observe.
The pictures that has been made in the last 1.5 years on what people, yeah. Oh, sorry, gaan bij u.
Or a room set up where a family is working with home education, homeschooling, and the others are working with computers and everybody.
The families got and everybody at home, working from home, and children having education from home. Yeah.
Objects that healthcare workers got, like the drawings and the things that got in the beginning of the epidemic.
Drawings that had been made.
I wondered if healthcare workers have received gifts as well that they might have from patients who have survived, and would they want to share those and tell the story, or would they want to keep them personally? Your idea of how to represent being trapped at home with everybody and doing everything at home. I did see an exhibition case from a project in America which is made up of all of the kinds of homemade things people have made because they couldn't participate in major events or activities they normally would. So there was like a graduation hat that somebody had made because there was no graduation ceremony to have, you know, and those kinds of things that I think can be really telling.
Representing what we missed also.
I mean, it's hard to represent absence or missing, isn't it? So that's also
what would you put in?
Oh, God. I don't know. I'll have to think about it more.
What's your first association with?
Well,
I'm think about COVID.
One of the things that I'm really noticed with the poster exhibitions that happen over and over again is that we don't know how people felt about those campaigns when they saw them. So you were talking about, you know, lines on the street or warning signs, or even about wearing a mask as you're walking into a shop, you know. I think we should collect more of the experiences around some of those photographs or posters so that we can tell a fuller story about them. What did it mean to encounter one on the street, you know? And it will be a wide variety of opinions, but that's part of what we have to get to.
Yeah. What I found really interesting, what you also explained, what we learned last lecture we had here with Lotte Jensen, who talked about the 17th century, that she also explained it's not only health crisis, but it is a social crisis, and that she also was very, astonished about it. That aspect was not in front of the treaty of the pandemic.
Yeah, I mean, I think that's one of the hardest lessons to learn, because it's more complex and more expensive to take care of social inequality and marginalization. And so, you know, putting all your money into technical developments is a simple way to look like you're doing something, the same as a mass media advertising campaign like the UK government. You know, that's a big way to make a statement. We're doing something that challenges criticism about all the other elements that need to be addressed.
But would it not also help in how to approach different groups that are, what you also mentioned, groups that are forgotten, elderly people, people in prisons, and etc.?
Yeah, and indeed we have to look at the impact on all of those groups and on all of the strategies needed to protect them.
Yes, sorry.
Regarding this line of thought, we see a lot of exhibitions which are including the technical, medical, scientific, the natural scientific part of the memories, but not the social scientific ones with interviews and videos like that. Did it happen anywhere regarding the HIV, or do you see it happening that these as well are taken into account to get to a museum?
Yeah, I'll try to to repeat. The lady is asking this, like the film we saw a part of, this social collecting, the experiences of people themselves instead of only medical development stories. Is that something you see? There's more more attention.
Yeah, I think in general, medical museums have begun to tell patient stories alongside practitioner stories. So that was already a trend to really think about health from those different directions, or a medical crisis. But exhibitions about pandemics really tend to resort back to a very traditional way of telling a story. So they tend to be chronological rather than thematic. So they do a march through time that implies we're getting better. Soon this won't be a concern anymore unless we, don't pay attention to the warning signs. And like you say, they focus very narrowly on medical breakthroughs that have changed things, and sometimes on public health initiatives as well, like the role of quarantine or testing and how important that is, But it's interesting to me as well that the history of public health measures is represented certainly in the media, in COVID, you never heard a reference to quarantine without the word draconian public health measures next to it. You know, there was a constant idea that things from the past are old-fashioned and shouldn't be used or aren't useful, and what we need to do is come up with the new technology that will save us now, you know? Whereas I think if we'd told that story of pandemics over time and said time and again, these public health strategies have been effective, we might have been able to get much more enthusiasm for them, you know?
Other questions? Do you think, is there, you are developing a tool. Can you tell some more about a tool?
Well, I'm trying to finish my book, so what you referred to in the introduction, next week is the week when I hope to finish the draft. But so the grant was to spend the last 4 years visiting European medical museums and talking to the staff there about what issues they think need to be better addressed, what is controversial or difficult to talk about today, and new ways of interacting with their audiences. So that's what I'm finalizing now. And it's interesting, when I applied for the grant 4 years ago, and it's the Dutch National Research Council that funded it, the first round of reviewers looked at the topics I wanted to address and said, well, you will leave space for a new health issue in case something comes up that you should include. Well, you know, I said, you know, you say what you need to say to get the money, right? So I said, of course, there's plenty of flexibility, not expecting really that I would have to use it. But I was already looking at AIDS, and so there will be a whole chapter on pandemics, and we'll also be able to look there at what is going on with COVID collecting and whether we can tell stories in a different, more useful way. Because the other thing that happens, to go back to your question, apart from this march through time and success, there's also a real tendency to tell global stories in very narrow national terms, you know, which I also think this has been so indicative of what a problem that's been, that we still think in terms of national response and the role of borders in a world that it's really not as easy to close off like that, you know. So I would love to see more exhibits that recognize those elements.
Yeah, but we are looking forward to this tool because we really need a protocol for the next pandemic, what to do. And we will not start by denying, it's so recognizable in the film, thinking that's not for us, but for other people, other countries. And we all had the same reflex, and it's human to do so. Yeah. But we should learn from this for the next round of this pandemic, or a variety of it, or something new.
Yeah, I mean, I can't claim to have all the answers, right? Nobody does. That's part of these complex health issues, need a lot of different perspectives. But it is very striking to me that we seem to make the same mistakes over and over again. And so AIDS, I think, is a very powerful story to revive and get people thinking about, so that we can try and learn better from what's going on now as well.
It's not the last question. I think last time we also talked with Lotte Jensen about the memorials that we can find back on all kind of pandemics that has been, and you show the examples as well from the AIDS pandemic, the memorial, the tapestry that has been made, things like that, and there are different memorials in different cities in the Netherlands as well. Do you expect that COVID will also, that we also will make our memorials on what has happened and all these people that died so alone and we were not able to go to their funerals?
Yeah, I expect so. I mean, I think part of the thinking about AIDS is that we've moved into a very active age of memorialization. So people are much more interested in building things to commemorate people who died of that pandemic, particularly because there was such a fight to be taken seriously from the beginning. There doesn't appear to be such a culture for the 1918 influenza pandemic. Yeah. But I would imagine, yes, that because we're part of this different moment in time, that this would be much more something that gets that kind of public attention. The question is, though, whether, again, it will tell that complex story of what made people vulnerable and who was most at risk and why, or whether it will just be a more simplistic honoring the dead and not investigating those tougher questions that still remain, I think.
That's true. Has someone another question? Well, then we will finish. Thank you so much that you were here. And thank you, Manon Parry, for your beautiful lecture. And we're looking forward to the book and the tool and more films. And the film, you can see the film on YouTube. It's easy to find.
Yeah, if you put Voices of the Epidemic, or you can look me up, manonparry.com, and there's a link to it there on the website.
And you will also find it on the website of this museum, Museum Boerhaave in Leiden. Nou, ook alle mensen thuis, heel hartelijk dank voor het meekijken. En als jullie nog vragen hebben, dan kan je ze ook e-mailen. Dan sturen we ze door aan Manon Parry. Of mocht je thuis zijn en denken, oh, ik had dat nog willen vragen. Dank jullie wel. Thank you so much.
Thank you.